The Punjab government had started the facility of free dialysis at civil hospitals across the province in November 2008 to benefit the poor people. The patients were provided with dialysis kits, injections and medicines for free, but the cost of this was 3 to 4,000 rupees per patient, and the hospital has had to discontinue the facility as there are no funds.
I have also talked to the DCO Saab, and he has also requested to the EDO Finance. I have also written 2 or 3 letters to the EDO and similarly to the higher authorities, and also written letter to the coordinator. But up till now we have failed to obtain the further additional funds for the dialysis. So for the next 2 or 3 months, so we will give the services, but the patients have to bring their own medicines and the kits.
Since the inception of this service, more than 2,500 patients have been operated upon. The provincial government provides 2.4 million rupees for each fiscal year and restricts the hospitals to conduct dialysis on 50 patients per month. The administration says that this limit is illogical, as Gujrat has the second highest number of patients with kidney disorders.
Because they give the logic that those districts who are a little bit backward or having not good facilities, they are to be encouraged, so that's why we provide the same number of funds. But I think if not 100% performance based, at least some portion of the budget should be performance based.
Patients say dialysis costs them 3 to 4,000 rupees a week, an amount they cannot afford to pay.
बड़ी जोर लगी रोना को किस पर यार मुझे लगूं तक कोई प्रोसेस नहीं दबता
मजदूरी नहीं कर सकते हैं, खर्चों में तो गुर्द नहीं है।
तीसरे दिन बाद डायलिसिस हो रहे हैं तो वो हम अपने पास से ला रहे हैं 1150 रुपए का, तीसरे दिन चौथे दिन इस तरह हो रहा है.
The administration of the civil hospital Gujrat has demanded the provincial government to get release the funds for the benefit of the patients. Mansoor Behzad, DawnNews, Gujrat.